Hello everyone. Today I'm going to talk about bronchiolitis and bronchitis. Alright. So as you can see, it's both happening in the near to the lungs, and bronchiolitis is commonly seen in less than 1 year of age patients. It can be seen in more than 1 year of age patients. Bronchitis. The major cause of bronchiolitis will be RSV, which is respiratory syncytial virus, and here the cause can be anything. It can be virus or it can be bacterial. More often it's viral cause. If we talk about what's happening in the bronchiolitis is, so RSV will be leading to lower respiratory tract infection, lower respiratory tract such as being bronchioles. As you can see in the bronchioles, there will be an infection and it will lead to inflammation, it will lead to edema, and later on it will lead to obstruction. So there will be problem in breathing. If you talk about bronchitis, same here. Inflammation of bronchi, larger airways. These are the bronchi where infection can lead to inflammation, which will lead to viral infection and lead to cough and mucus production. Mucus production further leads to obstruction. Okay, alright. If you talk about the risk factors for both, first bronchiolitis first. Prematurity, chronic lung diseases, smoke exposure can lead to bronchiolitis. Further, bronchitis risk factors can include smoke, pollution, history of COPD. If you talk about the clinical features, bilaterally, in bronchitis you'll be hearing crackles and wheezing. Bilaterally on both the lungs you'll be hearing crackles and wheezing, whereas in bronchitis you'll be hearing rhonchi and wheezing on both the lungs. In bronchiolitis, what are the other clinical features? Such as we have low grade fever, cough, rhinorrhea, while as in bronchitis there is low fever, maybe present or maybe absent, cough, dry cough can lead to wet productive cough. Next, moving on to diagnosis. So what are the diagnoses? Clinical diagnosis will be more than enough for identifying what the patient is having. So clinical diagnosis will be based on age, typical symptoms and signs, while in bronchiolitis, what you have to do is pulse oximetry should be done, because the patient might have low oxygen and you have to treat the oxygen by giving oxygen supply. And next, as it's caused by respiratory syncytial virus, you might have to do nasopharyngeal swab, PCR. Chest x-ray might not be needed. If you do the chest x-ray, there will be patchy atelectasis and peribronchial thickening can be seen. Whereas in bronchitis, the diagnosis will be same again. Clinical diagnosis will be enough, and no chest x will be needed unless high fever and respiratory distress will be seen. If you do the x-ray, here also you might be seeing peribronchial thickening. I'll talk about management. How do you treat both bronchiolitis and bronchitis? There will be no specific treatment needed for both the diseases. Only symptomatic treatment will be enough. Oxygen supply if it's less than 90 to 92%. Saline will be given. Hydration should be given. And same in bronchitis, no specific treatment. Antipyretics if fever is present. Hydration, rest will be more than necessary, more than enough. Honey if the patient is less than 1 year would be suggested. If you talk about complications in bronchiolitis, complications, apnea, respiratory failure, secondary infections can be seen, whereas in bronchitis, sepsis, secondary bacterial infection and pneumonia can be seen. Well, this is all about bronchitis and bronchiolitis in pediatric patients. If you like the video, make sure to subscribe and hit the bell icon.